Start with a right side short axis view of the left ventricle. Remember to place the transducer perpendicular to the right thorax. Anchor the elbow to the rubber mat. And anchor the index finger to the patient's body. Fan or slide toward the heart base until the mitral leaflets are seen. Continue to fan or slide toward the heart base, past the mitral valves, until a good image of the aortic valve is on the ultrasound screen. This image is often referred to as the Mercedes-Benz sign because the closed aortic valve leaflets in this position often resemble the Mercedes-Benz emblem. The closed aortic valve is the landmark for positioning the M-mode cursor. The right coronary cusp of the aortic valve is in contact with the right ventricle. The left coronary cusp of the aortic valve is in contact with the left atrium. The non-coronary cusp of the aortic valve is in contact with the interatrial septum. To the right of the aortic valve will be the pulmonary valve. Directly below the aortic valve is the left auricle and the left atrium. In dogs, the aortic auricle at this point is about the same diameter as the aorta. In cats, the left auricle can be a little larger than the aortic diameter. The left atrium is actually below and to the left of the aorta on the ultrasound screen. The right atrium and tricuspid valve are to the left and above the aorta. Heart-based tumors are often noted in this view. Tumors may be in the right atrial free wall, at the interatrial septum in the left atrium, or at the left auricle. Lesions of the tricuspid, aortic, or pulmonary valve may be noted. The left atrium and left auricle may appear enlarged. The right atrium or ventricle may appear enlarged. With an ideal image of the aorta, you see the Mercedes sign. Turn on the M-mode function of your machine. Use the trackball or touchpad to position the M-mode cursor directly through the center of the aortic valves. In most cases, the M-mode cursor in the far field of the ultrasound screen passes through the left auricle rather than the left atrium. Remember, on M-mode, you only see that tissue that is in contact with the M-mode cursor line. Activate the M-mode function and freeze when you have a good image. Use Cinematic Loop to select the best image. You see the anechoic chambers of the right ventricle and the left atrium. The right ventricular free wall is in the near field, and the left atrial free wall is in the far field. The hyperechoic walls of the aorta are in the center of the ultrasound screen. A high diastolic pressure of about 80 millimeters of mercury in the aorta will force the aortic valves to close in the center of the aorta during left ventricular diastole. Left ventricular systole raises pressure to about 120 millimeters of mercury and then forces the aortic valves open as blood is ejected from the left ventricle. On M mode, the aortic valves open to form a box during left ventricular systole. Activate the calculations package of your machine and measure the aortic diameter during left ventricular diastole, or the greatest downward movement of the aortic wall while the aortic valves are closed. Note that I use the left side of the horizontal bar of the calipers to measure. Then measure the left atrium during left ventricular systole, or the greatest upward movement of the aortic wall. High left ventricular pressure of about 120 millimeters of mercury during left ventricular systole keeps the mitral valves closed and allows the left atrium to fully fill at this point. Save these measurements to the patient record. Many ultrasound machines have an ECG lead attachment that allows an ECG to appear on the ultrasound screen. This allows M mode or two-dimensional measurements to be coordinated with the ECG. In veterinary medicine, the ECG clips can cause patient discomfort and struggling movements, which interfere with the echocardiogram. ECG leads are often not used in patients that are not sedated. Recently, sonographers are experimenting with the adhesive ECG attachments used in human medicine and placing them on the patient's foot pads. Alligator clips are then attached to the adhesive attachment. There are standard tables of aortic measurements for dogs and cats. In most dogs, the aortic diameter and the left auricle at this point are about the same size. In cats, the left atrium or auricle may be larger than the aortic diameter, but there are standard tables of measurement to compare to. Measurements of the left auricle exceeding normal limits suggest left atrial enlargement. In most animals, the left atrium will enlarge before the left auricle does. Therefore, a normal aorta to left atrial measurement from this position does not rule out left atrial enlargement.